sir, viewers know that what are the most groundbreaking treatments for tinnitus?
Research has been done on tinnitus from several universities in the world, basically. As I informed you, there is no cure for tinnitus, but however, technologies have been developed called management. So one of the company from Australia has developed what is known as neuromonics. That is one of the oldest acoustic neuromodulation technology, which is very much popular around the world, especially in the United States. They deal with musical therapy. They feel that music can reduce stress and anxiety, and that will help the tinnitus. The second major company advancement comes from London, known as the London Tinnitus Clinic, which have developed tonal therapy with a specialized headphone. This tonal therapy will deliver algorithm sound variations. They say the tinnitus pitch can be assessed, and then with that particular tinnitus pitch, we give the algorithm sound to cancel the tinnitus or to overcome the tinnitus, so the brain will acquire the plasticity. The third company comes from USA called SoundCure, where they say soft sounds will control tinnitus. Okay. They have done some cochlear implant surgeries on some tinnitus patient, but results are not very forthcoming. It's a very expensive surgery, and also that surgery is meant for totally deaf people, deaf children and deaf adults. So that's not very, at the moment, a lot of work has to be done. So the latest technology that is coming across is acoustic neuromodulation, which India has developed, called Tinnitus Trio. So Tinnitus Trio uses a battery of 4 programs. One is consolidated modulated tones on the lines and grounds of London Tinnitus Clinic. One, it uses the filtered music, not the normal music, the filtered music where all the frequencies are removed. The soothing frequencies are given where the limbic system or the brain system can relax. So this is known as the filtered music module that is there. The third is the environmental sound, because tinnitus people say, I hear the sound of a bird, I hear the sound of a water, I hear the sound of an ocean. So
does it vary from patient to patient?
Yes. As number of patients, as many of people complain that I hear this sound, I hear the buzzing of the
different sounds.
Different sounds, birds, this thing, that thing. So when we do the testing, we take care of this basically. So we have got what is known as the environmental sound module, consisting of 250 sounds, in which most of the patients will fit into one of the categories. Then the fourth is the noise, because it has been proved that noise suppresses tinnitus. Okay, in the olden centuries, what used to happen, the palaces used to have fountains. So those who have tinnitus go and sit near the fountain, the waterfall will cease to have the suppression on the tinnitus. So the same technology is used here with calibrated sound called masking noise. So the masking noise will suppress tinnitus. But before that, the patient has to undergo a full-fledged ENT examination, where the ENT doctor will scrutinize his ear. Then he will have to have the audiological test batteries about his hearing status. Then the neurologist has to see him for the x-rays and all these things, rule out all these things. Then it becomes a functional thing. Then acoustic neuromodulation comes into the play. Here there are 2 segments. One is tinnitus testing. We have to test the tinnitus at single hertz frequencies. Single hertz means when we do the audiological test, normally we go at 500, 1000, 2000, 4000. Here we have to do at every hertz, 5000, 5001, 5002, 5003. Because some musicians who have tinnitus, they say my tinnitus is 5540. So because they appreciate music, so they appreciate the tinnitus much better than a layman. So we'll have to do a single hertz tinnitus audiometry. So when you do the single hertz tinnitus audiometry, we come to the conclusion where his tinnitus falls. Then we do this tinnitus trio training. Then we do a session of counseling, telling the patient that you don't have a disease, this is a symptom. Make him very clear, make him comfortable, make him peaceful, and at the same time make him understand what his problem is. Otherwise he'll be running from pillar to post basically. This is known as cognitive behavior therapy, which takes about 3 to 4 sessions, and these sessions have to be repeated in the course of time. So once this is done, then we fit up this treatment portion in 2 ways. One is in the mobile phone of the patient, and one is in the tablet. So earlier technologies from Australia and London, they have an instrument by itself. So many people don't like to use instrument when their hearing is normal for tinnitus, because cosmetically they feel that it is something wrong. So we have brought it out in the mobile phone so that they can use it Bluetooth and nobody will know that he's taking the treatment. Or with the headphones basically. So these 4 modules are divided for him into different minutes to be used. So normally the results are, after 6 to 8 minutes of usage, about 30 to 40% get benefit. They don't get cured from tinnitus. Let me tell you that they don't get cured from tinnitus, but they are able to manageable. What happens here in the treatment is the frequency from high frequency is shifted to a lower frequencies. So lower frequencies tinnitus is tolerable. So the management takes place from that. The relaxation technique is done through the filtered music, because filtered music is given for people who have sleep deprivation, depression, and anxiety and neurosis. So that is covered by the musical therapy. And the masking noise, suppose he has a meeting, he has got severe tinnitus, he can use a masking noise that will suppress his tinnitus during the working hours, during the computer work, or during his normal course of work related meetings and other things. And the environmental sounds will give the same sound what he has in the ear, that will cancel that signal, and the brain will learn to rewire. So it is a question of neuroplasticity of the brain, where the brain learns to rewire.
So are all these treatments available with us?
This new technology called Tinnitus Trio and Tinnitus Station came about 2 years back. We as researchers, we are pioneers in this field, having done research for last 5 to 7 years to develop this program. So we have started in many centers in India recently, and the Asian Diagnostic Center, or the ENT CARE Center at Begumpet, Hyderabad, is one of the few centers in South India that have got this technology. They have a full-fledged tinnitus laboratory for doing all the tinnitus workup and tinnitus studies, and they also have this tinnitus retraining therapy and tinnitus disposal of the equipment into the patient's tablet or into the patient's phone, or we give a dedicated tablet or a phone to the patient for him to take treatment, and the patient is being monitored every month in the clinic about his progress, or if there is anything further workups to be done. So there is a continuous follow-up, because follow-up is very important, relaxation is important, and counseling is important for this patient. So all these treatments are available at Asian ENT Care at Begumpet, Hyderabad.